It was a gun.
I'm not voting.
If we want to build our nation.
The problem with the Somalians.
Just want to experience something else than a black man.
Move on, move
Can't be
forward.
like a horse with blinkers on.
Honestly say, I was about to have
Corrupt
sex and then I pulled
crap,
up.
but it's nice.
My name is Ulwazi Okwambanzi Sibongo. I'm a feminist, I'm an activist, I'm a researcher, a concerned resident, and I live in Kempton Park.
My name is Lucia Komu. I'm currently staying in Pretoria in Mamelodi. I'm a feminist.
I'm Carmen Sibusi. I am a nurse and I currently stay in Rustenburg.
I'm Lorraine. I'm a professional nurse and I currently reside in Lyndhurst.
I'm Constance. I'm a professional nurse. I currently reside in Johannesburg.
I've always thought that, you know what, nurses are just angry people. They are always angry. And I often also go with the shield when I go to a public hospital because I don't use a private hospital, but I go with the shield that it might just go out of proportion. So would I be correct to say that nurses are angry?
I'm a registered nurse for now more than 20 years now. And my specialty is the pediatric ICU, of which is looking after those very, very sick children. And in itself, being in that environment in itself, it's a stressful environment because you're looking at a child who's very sick. You're wondering if this child is going to make it or not. Somehow you will know, somehow you would not know. But then when the unexpected happens, let's say, for instance, a child dies in your hands or a child dies in the unit where you are working, and you think about your own children and you ask yourself, what if this was my own child? Or how do I comfort this mother?
Well, for me, I work in a public clinic. So we serve the clinic. I serve the community in a clinic. So I don't do the hospital, thank God. So what she shared was more of an emotional challenge that we have as nurses. And then on my side, though, one of the things that actually lead to us having this burnout is the fact that we have a large number of people that we actually have to see in a day-to-day basis. And yet we expected to see these people with a really skeleton stuff. So my issue is there'll be more than 300 patients to be seen on a day and actually a really few of us. So that would actually lead to this burnout over time. So you end up having this complaints from the community that, well, I got an attitude from nurses, and the actually cause of that is the fact that there'll be 3 nurses who has to deal with more than 200 patients. So I'm just saying that as an addition to what she was saying to be a cause to burnout.
I think more than anything, what Lorraine just said is the, especially for us nurses that are working in public sectors and working in clinics, because when you're working in a clinic, you're supposed to see everybody. It's not like working in a hospital where you are assigned to a particular ward and you just work in that ward. When you're working in a clinic, you see everybody, and you're expected that if the department that you're working in is not that full, they will move you from that department and put you in another department. So it's like if you get in the morning, you go to work and you know you're working child welfare. After 4 o'clock, child welfare closes. They're expected to go help out in other areas like your maternity area or casualty. So you see, you get to work with knowing that at the end of the day, I'm going to be seeing more than what I'm capable of seeing. And the next day, the same process happens again. So it's those demoralizing things that you don't understand why isn't there enough staff for each and every department.
You have your supportive staff, but you find that I have an experience of being in a ICU where doctors are just shouting left and right, shouting left and right. And at some point, you feel like it feels like I'm nothing. You do work hard, you do your best, but you get this doctor who comes and just shouts at nothing, just shouts. It's in the blood for them to shout. And you're supposed to take it in and say it's okay and keep on working, because you are a nurse. You've become a nurse. You've come to an environment where you know that you are supposed to serve people.
At this point in time, globally, we're faced with COVID-19, which has been highly disruptive. I mean, we have the world is dependent on health professionals to best manage the pandemic. And I think during this time, as much as we are solely reliable to you professionals, are you best taken care of? What are the conditions that you work under?
During this pandemic, I must say, working environment for me is okay. We don't really see a lot of COVID patients, and also I'm okay.
With us, it was hell in the beginning. It was hell because there would be no gloves. There would be like a whole lot of things wouldn't be there. There wouldn't be proper PPE that we had to get. It's only when some of the staff members started contracting this COVID that now management was like, something needs to be done. One of us had to, lay in hospital because of COVID, for them to like now raise their ears and say, but what if now the entire clinic becomes sick? So something has to happen drastic for them to actually give us equipment that we need to give the proper care that we are supposed to give. So it's a bit disheartening when they do that, because we do want to go to work and serve the people that we are there to serve. But now if you have to go to work and you don't have proper equipment, then what?
So Carmen, would you say that if one of you gets COVID, because you mentioned that there's a shortage of staff members, you don't quarantine, you are expected to report to duty?
The first 3 nurses that got COVID, one of the managers asked them, are they sure that they got it at work? How are they going to know where they got it?
Really?
Because they've been coming to work every day. Now they are being punished for having COVID and being asked a question like that. This one lady stayed in hospital for 21 days, which was hectic for her. And she was the one who was asked, well, are you sure you got this from work?
All I know is most of our colleagues had problems with, again, staff shortages, because a lot of us actually contracted this disease. And it's so unfortunate, like she said, that some of the people were being asked, are you even sure that you got it from work? Which was really quite unfair. I just know that a lot of nurses were discriminated with this thing. Some of them were told, well, you have tested, but you still need to come to work and wait for your results. A lot of people experienced a different thing when it came to this COVID. And well, like you also said, some nurses also had a problem with PPEs. Well, a lot of them I know. I know a lot of close friends that had problem with PPE where they were given one mask to work with the whole day. It was just a lot of different issues. But I also feel that in some instances it was not handled quite correctly. But I think at some point we ended up getting into the rhythm of how to manage it.
We don't really have a problem with the COVID at my institution right now, but general other things, like if you feel that you're not being listened to, if you feel that you don't have a platform to voice out your concerns, then the next thing that you do is you bottle everything up. And once you bottle everything up, it means what? It means your work is affected. You're going to be absent one way or the other, either by taking leave annual leave or you take sick leave. But if you really feel pressure that, no, man, these people are not even listening to what I'm saying. So what are you going to do? You're just going to take sick leave and stay home.
Do we even have a platform where we can actually say to our superiors that we are not coping? You know you're going to get something negative from them. So do you really have to? That is why there is a lot of sick. That's why a lot of us are always getting sick. And it's not that you are sick, it's because you are tired. You don't want to be in that environment. So you'll take from your sick days and stay home.
For us, we have a support system. We have ICAS. I don't know if you know about it. We have ICAS, which is a lifeline that we use at work. If you have any problems whatsoever, you just call them. It's a free call. You can call them from your cell phone. You can call them from wherever you have that. So you can call them at any time and tell them your problems, and they will assist you however they can assist you. So we have that kind of support system in place. But having said that also, you are going to call ICAS, but they are not directly involved with you at work. You have people who are directly involved with you at work, like your next managers, who are not even supporting you. Like they tell themselves that no, there is ICAS. I mean, even if I know there is a support system in place, okay, a manager cannot take all of the people's issues and all that by himself or by herself, but you expect some support from them, you know.
At the end of the day, the people that are suffering are patients that receives treatment from nurses. But now, how do the nurses get the morale to give out and dish out good services when they themselves are not well taken care of? And it's sad because they are the face of hospitals and clinics. They are the first people that we see when we walk in. So they carry all the mockage from communities, from patients, where else the big people up there who they think they're doing a lot of work, which they're not doing anything, because these people who they refer to, yeah, they're not doing anything. They just call the shots and expect things to roll when they don't do anything. But the actual caregivers, they don't get the support and you know, it's so unfair because they receive bad comments from patients, bad comments from their superiors. So they're like caught up in the middle, and they still love and have the passion for this job, you know.
You know how nurses are. If there is shortage of something, we always make a plan. Nurses, that's how nurses work, and I think it's part of the things that actually cause, in the long run, that they develop this burnout thing. You know, they will work under pressure. You'll be told, well, there's no injections, then we'll make a plan. And unfortunately, we do, because at the end of the day, we are a caring profession, and the objective is so that a patient is being sorted out.
My dream is to see nurses happy because they are the face of the health profession.
My dream is to see the nursing profession being transformed.
My biggest dream for nursing is that management at some point, I wish that we could be, I don't know, remunerated better, like paid better.
I wish just for us as nurses to be allowed to have that safe space where we can talk when we are not okay.
My dream would be really, they need to be recognized financially, especially during this time where we are solely dependent on these professionals.
Yeah, Z, you should ever sit and talk with people, or else take a walk and create a straight talk. Talk what is nice, it will make you feel stronger. Listen what is right and say what is wrong. You should ever sit and talk with people, or else take a walk and create a straight talk. Talk what is nice, it will make you feel stronger. Listen what is right and say what is wrong.